February was Heart Health Month. Inside Sequoia Ray is in the studio with a special guest who has advice and tips.
Hello, I'm here with Laura Savage, a registered nurse from the VCU Pauley Heart Center. Thank you for being here.
Thanks so much for the opportunity.
So we just finished up with Heart Health Month in February. How did the Pauley Heart Center participate?
Well, February 4th was actually National Go Red for Women, and Go Red for Women is a campaign to educate women about their heart health. So one of the things that we did, we had a display for the community that focused particularly on risk factors for women and heart disease. We had members from the Heart Association there, as well as some of our patients, particularly our women with heart disease, so that they could relate to the public and educate them.
Well, over 90% of women have one or more risks for heart disease. What are some of those risks?
Well, there are a number. One, hypertension, high blood pressure puts women at risk. Diabetes, smoking, stress, diet, and lack of exercise are a number of the risk factors that can contribute to heart disease.
You mentioned high blood pressure and smoking. What are some of those things that we can control, or how can we control those risks?
That's a great question. Hypertension in particular is often referred to as the silent killer. About 21% of people with high blood pressure don't even know that they have it. So it's really important for them to know their numbers. Specifically, hypertension can be defined as a blood pressure greater than 120/80. And there are a number of things that women can do to reduce those risks. So for example, reducing their salt intake, increasing their exercise, maintaining a healthy weight, monitoring their stress, and you talked about smoking cessation, quitting smoking, as well as limiting their alcohol intake. All of those are strategies that women and as well as others can do to help to either reduce or prevent that risk of hypertension.
Right, so what are some symptoms that we should look out for?
That's a great question. Women present very differently than men. When you see the emergency and on TV, women, they talk about having crushing substernal chest pain that radiates to the arm. Women don't always present with chest pain. It may be shortness of breath, it may be fatigue. They tend not to really recognize those symptoms and just dismiss them as, oh, I'm busy, you know, I'm stressed, I'm working, I'm taking care of the kids, and they don't pay attention to their body. So it's very important for them to know their risk, as well as the fact that they may not ever really experience chest pain the way that a man would present.
So how can we pay attention more to those symptoms?
Well, one of the things is knowing your numbers, identifying your own risk, knowing what your high blood pressure number is, knowing if you're diabetic, what your blood sugar is, knowing what your cholesterol is. And by knowing those numbers, that'll help to reduce the risk and be able to help you put a plan in place to modify those risk factors.
Right. So if I wanted to start with a healthier heart tomorrow, what should I do?
Well, I'm so glad that you asked. The American Heart Association has started a campaign called Life Simple 7. And I've got this little bookmark here. And I would really recommend people go to this www.mylifecheck.org, because what you can do here is you do an inventory and an assessment of your own risk. So it'll give you your numbers or tell you strategies for those numbers, and also give you a plan to be able to start today. One example is exercise.
Again, that was registered nurse Laura Savage. Thank you for being here.